Hey, this is Dr. Jen, and today we're going to talk about all things related to sexual and reproductive health. This is Doom Scroll.
Hey, Jen, you got your coffee?
Hey, Tessa, I'm ready. This is like coffee number 3.
Me too. And it's way too early for the third one, but I need it. I'm not saying you're old, but you've been practicing for a while. So, have you seen any differences in reproductive health practices, contraception since the Affordable Care Act?
Well, yeah, no, I mean, goodness, I remember, not having the ACA around and now having the Affordable Care Act as a player in the space. And so what has that done for us, in the provider world who treat, a lot of patients in sexual and reproductive health is really that it has expanded the ability for people to get contraception tremendously. And so part of that is because the ACA, covers a lot of the contraception and birth control benefits. In fact, it covers counseling as well as the prescriptions, and it does not charge copay or coinsurance as long as you're with your in-network provider. And this is even if you haven't met your deductible. And so that's huge for people, right? Because even meeting those deductibles can get very expensive.
This is helpful for me as well in clinical practice. So it covers both the counseling, so just talking to someone about the emergency contraception, as well as starting it or putting it in place as well, like the long-acting forms like IUDs or Nexplanons or things like that.
One of the things that it did was also expand access to those types of prescriptions and care, even when the person lost employment. So, I mean, I don't have to tell you, right? When people lose their jobs and they lose their coverage through their job, this becomes like a huge issue for people because there's a lot of times a lapse in care. And so, again, the ACA expanded that coverage for these contraception methods through, a potential loss of employment. The ACA, when they consider contraceptive methods, they're covering anything from, the pills or hormonal contraceptive methods, as well as IUDs, for example, sterilization procedures for women. That being said, though, it doesn't cover sterilization procedures for men, right? So things like vasectomies, and also it won't cover abortion services.
That is super interesting because vasectomies are a much easier procedure than sterilization for female anatomy.
I agree. I would even argue, some might disagree, that it's almost as simple at this point as inserting an IUD sometimes, right?
100%. This would apply to everyone who has care under the Affordable Care Act, and anyone could access these services.
So for the most part, and I'm glad that you brought that up, there is one exception to that rule. So if the person under the ACA is working for an employer that is a religious-based employer, then those particular groups are exempt from having to cover the contraceptive methods and counseling. That's probably my biggest issue with that, right? Is that it even exempts them from the counseling. So if you are someone who's working for a religious-based employer and you need contraceptive methods and counseling, you might have to pay that out of pocket. But I think, again, the best way is to contact your employer so that you can understand what your benefits are and have the appropriate information. That group of people might have to seek care, outside and pay out of pocket.
Thank goodness that we have a lot of education online about contraception as well, and hopefully we're able to reach those populations in some capacity.
There are free options out there as well. There's free clinics, there's safety net clinics, there's community organizations that are providing these services through, providers going out there and seeing people out in the community and giving out these contraception prescriptions. And so do your research, reach out, but try to get yourself, good sexual and reproductive health education through social media, whatever means it takes, and then leverage those free options that are available out there. Not as readily, but they are.
All right. See you next week.
Bye. Thanks, Tess.
Bye.